So often when we come across patients with BRCA mutation-related cancers in clinic, the things that might highlight or may suggest that they have a germline mutation in BRCA, maybe that they're a younger age, so with younger patients, they may have had a history of a breast cancer or ovarian cancer previously, so possibly a patient or woman who presents with bilateral breast cancer or had a breast cancer in the past. These patients may have a very strong family history of cancers, in particular breast or ovarian cancers, particularly in first-degree relatives. If when we see somebody in clinic and we suspect that they may have a BRCA-positive breast cancer or ovarian cancer, we might have a preliminary discussion with them about it, and maybe this is something that the person has already thought of themselves. So we discuss that and decide, yes, maybe we should proceed with testing, but in the first instance, we would always send them to certainly in the practice I work, we would send them to our geneticist, and they would always see a genetic counsellor, because it isn't a simple test. It's a simple test in that it's a blood test, but really the implications of it in terms of their subsequent management and possibly their treatment is huge. There are a lot of similarities with how we manage other non-BRCA related cancers, but there are also some differences. Sometimes they have a particular type of breast cancer, for example. We often see patients with BRCA1 mutations have triple-negative breast cancer, although it's not exclusively triple-negative breast cancer. Often these patients need treatment with chemotherapy, obviously surgery, radiation therapy, and then possibly hormone treatment or not. That's in the early disease setting or presentation. Because we've identified in these patients that they carry a mutation in BRCA1 or 2, it has implications for them in that they may be they are at risk of developing a further breast cancer or indeed ovarian cancer. And obviously their families are also potentially carrying this mutation and may need to be tested or may want to have testing or not. The management of these patients is very multidisciplinary in that they need to obviously talk to me about treatments of this current cancer, and then how you might reduce their risks in the future of developing a further cancer, so be that with risk-reducing surgeries such as bilateral mastectomies and oophorectomies, and also whether they require chemotherapy or any other ongoing kind of chemopreventative agents. There is a whole other area of the fact that they're very young, and many of these women may want to start families and have families, and there are all the implications of that and what treatment might do and the timing of their families and treatment. So they're quite complex discussions, and there are many meetings over a period of time. So everybody has to be very clear with a clear and happy and a consensus as to the approach we're going to take for an individual woman.